This is part 3 of chapter 9, beginning with the condition called histoplasmosis, a systemic disease or pneumonia due to a fungus, Histoplasma capsulatum. Systemic disease, this can affect much more than just the lungs. The person's spleen and lymph nodes may also be enlarged and affected by this condition. The fungus disseminates throughout the pulmonary tissue. The person with any type of suppressed immune system is more likely to get sick for this particular fungus. The person that has the pulmonary disease associated with histoplasmosis will have fever, dyspnea, difficulty breathing, loss of energy, experience fever. There have also been cases identified in which the person was asymptomatic until much later in the progression of the disease. Notice the etiology here. Caused by a fungus which is carried by dust and is inhaled. Often the fungus is found in soil contaminated by droppings from birds or bats specific to the area, which may be the source of the airborne fungus. Treatment for the disease. There are some antifungal drugs that are effective in treatment. The amphotericin B is often effective, used to treat the more severe or progressive disease. This is fortunately usually self-limiting in that in many cases they will not even need the antifungal drugs. Spontaneous recovery is what they usually see with the histoplasmosis. Okay, let's look at influenza now, which is certainly much more common than histoplasmosis. Generalized, highly contagious, acute viral disease that occurs in annual outbreaks. Each year you'll hear reference to the flu season, whether you're listening to the news or reading the newspapers. Influenza. Inflammation of the upper and lower respiratory tract mucous membranes, severe protracted cough, fever, sore throat, headache, generalized just feeling bad, muscle aches. GI disorders may occur with the influenza. Onset usually sudden, marked by chills and fever. In mild cases, the fever is up to 101 or 102, and it lasts for 2 or 3 days, and in more severe cases, it even goes up to 103 and 104. The acute symptoms usually go away pretty rapidly when the fever goes down, but the person may remain in that weakened state for even a couple of weeks before full recovery. It's caused by a virus, so antibiotics are not effective, but sometimes the doctors will prescribe antibiotics just to help the person to not go on to develop a more serious bacterial infection on top of the influenza. Particularly serious in the elderly or those that are chronically ill. Because it's viral, if the person gets to the doctor soon enough, early enough in the influenza infection, there are some antiviral drugs that may be given and may be effective. Mostly the treatment's going to be just bed rest, fluids, and to keep the fever down. It is important to be vaccinated against the flu each year. There's a vaccine that's used each year that is developed based on the Centers for Disease Control, and the experts as far as study of disease will determine which type of flu is more likely to be the worst for the following year, and they'll develop a vaccine against that flu. Sometimes they're right and sometimes they're wrong. The researchers are now closer to developing a flu vaccine that will be universal for all strands of the flu viruses, which is really good news, but they're not looking for it to be released for use in the public until about the year 2011 or 2012. But it's still very important to get the flu vaccine, especially for certain groups of people, like people who work in healthcare and more exposed to the flu. and for those chronically ill and the elderly. Okay, COPD, chronic obstructive pulmonary disease. We're actually dealing with a group of diseases when we talk about COPD. There's several different conditions that may result in COPD, but look at the words and you realize what's going on here. Chronic, it lasts for a long period of time. Obstructive lung disease. The person's going to have some obstruction of their bronchial passageway, some problem as far as getting the air in that they need and for the effective gas exchange to take place, to be able to breathe in the oxygen and have that gas exchange and breathe out the carbon dioxide. There's problems with this process when a person has COPD. Now, these are some of the conditions that a person may have that are referred to as COPDs: chronic bronchitis, bronchiectasis, emphysema, chronic asthma, and pneumoconiosis. When a person has COPD, they usually have more than one of these conditions working in their lungs at the same time, and they usually have these conditions for a long period of time. COPD. I've got much more on the screen on the PowerPoint slide than what you see in your book. COPD is extremely common. It's especially common in the older population. And I teach medical coding to the health information technicians. And when I teach about coding COPD, it's very important to identify exactly what type of COPD the patient has, and to code it as chronic bronchitis or emphysema or asthma, whichever the physician documents as being the type of COPD. When a person has COPD, they usually have exertional dyspnea, which means they have difficulty breathing or shortness of breath when they try to exercise in any way. And I don't really even mean organized exercise. I mean get up in the chair and walk out to the mailbox. That they have persistent exertional dyspnea. When they just try to walk across the room after this has progressed so far, they'll have trouble breathing. The patient is also going to have cough, wheezing, weakness, weight loss, and recurrent respiratory infections with COPD. There's no real cure for COPD, just treatments to try to control the symptoms and slow the progress of the condition. The number one thing will be that the patient needs to stop exposing themselves to whatever it is was the initial cause of the chronic bronchitis or emphysema, such as cigarette smoking. Cigarette smoking is the number one cause of chronic bronchitis and emphysema and COPD. So it will help if the person will stop smoking. Antibiotics are going to be necessary because of the frequent infections. The patient will be placed on some degree of oxygen while they're in the hospital, and they may or may not have supplemental oxygen at home. Chest physiotherapy, medications like the bronchodilators, like aminophylline, epinephrine, corticosteroids are also widely used to treat COPD. Really common abbreviation that you need to know and, of course, know about the disease. Bronchitis listed next is inflammation of the bronchi that may either be acute or chronic. Signs and symptoms, of course, the person's going to have cough. If you've ever had bronchitis, you cough. Very productive cough should be. Pain in the chest because of the coughing, usually some shortness of breath and wheezing. The elevated temperature depends on whether it's acute or chronic. In acute cases, the temperature is usually elevated. Chronic usually don't have so much elevated temperature. It's more of just the long-term productive cough. Number of different causes. Again, cigarette smoking is listed as one of the main causes of chronic bronchitis. The acute bronchitis is that usually due to viruses or bacteria. There's also other environmental factors that may contribute to the chronic bronchitis. Treatment, again, kind of depends on whether it's chronic or acute. If we're dealing with acute bronchitis due to bacteria, certain antibiotics are going to be needed. The chronic bronchitis, the patient usually has a humidifier or vaporizer that they use, and they take bronchodilators and have an inhaler that they carry around with them, cough suppressants, and then antipyretics for fever like aspirin when necessary. Acute bronchitis is certainly more serious in the very young, in the elderly, and the chronically ill. Chronic bronchitis has a very specific description to be considered as chronic bronchitis, and that is that the patient has a productive cough for at least 3 months of the year for at least 2 consecutive years, and the most common cause is cigarette smoke. The chronic bronchitis leads to hypertrophy of the mucus glands that line the respiratory tract. That mucus, and that hypertrophy, the mucus becomes thickened, and after a while that thickened mucus interferes with the air passing in and out of the lungs, and the person will develop some form of hypoxia, not having enough oxygen in their tissues. Chronic bronchitis may lead to infections like pneumonia, conditions like emphysema and bronchiectasis, and again the COPD that I've mentioned earlier. Bronchiectasis, permanent irreversible dilation of the bronchus or bronchi, results from destruction of the muscular or the elastic portion of the bronchial walls. It usually takes many years for the bronchiectasis to develop, and it's usually due to some other chronic condition. The patient's going to have chronic cough. They may even cough up blood and other foul-smelling secretions, dyspnea, wheezing, just a general bad feeling because they're unable to have the oxygen exchange they need because of the bronchiectasis. Usually secondary to smoking. Could be secondary to other gases or environmental factors, inhalation of corrosive gas, and certain infections may result in the bronchiectasis. The treatment's going to be all about antibiotics to prevent or treat infections that occur, and the postural drainage, helping the person to learn to do chest physiotherapy, or at least a caretaker to do the chest physiotherapy and posture the person so that they have better drainage from their respiratory tract so they can cough up this material that accumulates in the lungs. Okay, asthma. We looked at asthma back in the chapter on the conditions of a child, which certainly asthma can affect children, and children may grow out of their asthma, but adults can certainly always have asthma also. Adult onset of asthma usually occurs in the middle age group or maybe older, usually because of smoking. There's other triggers though. It could be something that a person is allergic to, that they're constantly exposed to. When a person has asthma, their bronchial tubes will spasm and narrow, and the person cannot really breathe in air, or it's even worse on trying to exhale to get the air back out. Paroxysmal dyspnea, difficulty breathing, it comes on real sudden. They have wheezing and coughing that are what are considered integral symptoms of the bronchial asthma. Again, the allergy to smoke or other environmental factors, infection, may be aggravated by anxiety, cold, and exercise. There's really no cure, but the hope is with treatment that the attacks will become less severe. Treatment especially with bronchodilators. And status asthmaticus. It's not described on this particular page in your book, but I do want you to know that status asthmaticus is the most severe form of asthma, where the person's asthma attack does not respond to treatment. The usual bronchodilators that control their asthma attacks don't work properly because of the severe asthma attack that the person's suffering from. Okay, emphysema, described as hyperinflation of air sacs with destruction of alveolar walls. If you look back at the anatomy of this system, of the anatomy of the lungs and the tiny air sacs where the gas exchange takes place, those tiny air sacs, when you breathe in air, should kind of inflate with the air, and when the air breathes out, a little deflation there, and it's kind of they have elastic walls so that they can move as you breathe in and you breathe out. And it's the walls of the alveoli that allow for the gas exchange of oxygen and carbon dioxide with the capillaries. In emphysema, those little air sacs have hyperinflated, and they've stayed in the inflated state until the point that their elastic walls even break down, and sometimes they even burst because of the progression of the disease. It is associated with heavy smoking and other environmental factors and air pollution. The earliest signs and symptoms, the dyspnea again, difficulty breathing, tachypnea, rapid breathing, wheezing, and a moist, persistent cough. As far as the treatment for emphysema, the person is going to need help with bronchodilators and help to prevent infections. The disease will continue to progress until the person has this very distinctive barrel chest appearance. Your book does a wonderful job of showing you what a person with emphysema looks like, including the circumoral cyanosis, which is a bluish discoloration around the lips. Pulmonary function test will be done to determine how far the emphysema has progressed and do the initial diagnosis of the emphysema. Treatment again, supplemental oxygen, bronchodilators, antibiotics, even corticosteroid, anti-inflammatories. Next is pneumoconiosis. And if you read about the description of pneumoconiosis, any disease of the lung caused by long-term dust inhalation. There's various types of pneumoconiosis that depend on the type of dust that the person inhales. There's asbestosis that is due to being exposed to asbestos, which at one time was used as insulation in many buildings and ships. Anthracosis is the inhalation of coal dust. It's also called black lung disease. Silicosis, another type of dust disease where people who deal with grinding metal or stone or working quarries are more likely to develop this type of pneumoconiosis. Anyone that's constantly exposed to any type of dust is very likely to develop some form of pneumoconiosis. They'll develop dyspnea, that difficulty breathing, especially on exertion, dry cough, usually the first symptoms, and as it becomes worse, the cough becomes more productive. Pulmonary hypertension is very likely to occur in a patient that has pneumoconiosis. Tachypnea, fast breathing, recurrent respiratory tract infections. Family members are also at risk because the dust that the person's exposed to, they often bring home on their work clothes and expose their family members. Treatment is going to be, of course, to get away from whatever is causing this pneumoconiosis, and bronchodilators, oxygen therapy, and chest physical therapy. Okay, pneumothorax is the next condition to look at, which is an accumulation of air or gas in the pleural space. Again, you may want to look back at the normal anatomy of the respiratory system and see that the pleural membrane the pleura surrounds the lungs, and there's two parts to the pleura, and there is a space between the two layers of the pleura, and it's called the pleural cavity. Air or gas gets in this pleural space and causes a collapse of the lung. The pneumothorax is a reference to the air or gas in the lungs, in the pleural space. Again, the person's going to have shortness of breath and some sudden sharp chest pain, falling blood pressure, rapid pulse, absent breath sounds because of the collapse of the lung over the affected side. This may be spontaneous, maybe because of trauma, maybe because of infection, or iatrogenic. It may actually be caused by treatment. Treatment depends on the cause. Certainly if it's due to bacteria, then bacteria will be treated with antibiotics. If it's traumatic, then whatever the trauma is should be treated. Like a gunshot wound may cause the gas or air to escape out in the pleural space, or a stab wound in the lung area. Tuberculosis is the next condition here. Tuberculosis you've probably heard of, caused by tubercle bacilla, Mycobacterium tuberculosis, and there's different strands of this bacterium, and unfortunately there are now strands that are resistant to the antibiotics that we once treated the tuberculosis in this country with. And it's spread readily by droplets in the coughs and sneezes of the infected individuals. Patients that have TB are a danger to other people, and hygiene precautions must be taken. I heard recently on the news that they were looking for people who had flown a particular flight on a particular airline, that they know that a patient had tuberculosis that was on that flight. So they're looking to contact all the people that were on the flight to determine if they may have contracted TB from that person who was coughing and sneezing on that plane. The very earliest stages, when a person first develops TB, they'll be asymptomatic. So they will have to go through testing to determine if they really have the TB. It's the later symptoms when they really start having more of the pulmonary symptoms with the cough and so forth. Reduction in weight, reduced appetite, vague chest pain, loss of energy all go along with tuberculosis. And in the later stages, the person will have a productive cough, night sweats, and the hemoptysis is when they're coughing up blood, and that's the very later stages of tuberculosis. In the first infection, the person will develop a small lesion on their lung, and the bacteria will then spread through the lymphatic tissues. Tuberculosis is not just a disease of the lungs. It can also spread to many other areas of the body. When a person has a primary infection and they get that lesion of the lung and it spreads to the lymphatic system, they may actually completely recover. But then they're left allergic to the bacillus. And that's the way the TB skin tests work, that if a person has in the past had that TB bacillus, and even though they may seem to be perfectly healthy now, when the TB skin test is performed, they use a protein purified from the bacillus and they inject it under the person's skin. And if the person reacts with an allergic reaction, that is an indication that they have in the past been infected with TB. On their reactivation of the bacillus through future exposures, they develop secondary lesions and not an exposure through the TB skin test. Let me clarify that. Future exposure to active TB bacilli. Then they're more likely to develop the scarring in the lungs, the tubercles that form in the lungs. They develop this caseous material The mass is referred to as caseation, and then eventually the mass liquefies. They may even cough up all that liquid, and it leaves a cavity in the lungs. If it's deep enough and the cavity wears through blood vessels, then they develop that hemoptysis, and that's one of the later stages of the tuberculosis. The acute tuberculosis, pneumonia, usually results in death. The acute miliary tuberculosis is when the bacillus spreads through the bloodstream to the other major organs. PPD and MAN2 are standard TB skin tests that are used at this time to identify people who are infected with TB. If a person shows a positive skin test, they should have a follow-up chest x-ray to determine if they have those cavities that have formed due to the tuberculosis. Treatment is a long-term treatment, usually 9 months or more. In fact, more commonly 18 months or 2 years. And that makes it really difficult to treat patients that may have tuberculosis, even though the treatment they can receive from the health department. Often people who are transient, people who are immigrants to this country may have the tuberculosis and spread it to other people, and they may move from place to place and not stay in one area to receive the full treatment for the full 18 months or 2 years that they need the treatment. I've listed on this slide some of the common drugs used to treat tuberculosis, and these drugs are also listed in your book under the title of treatment. Treatment can be effective, but the person has got to take a number of different medications over a long period of time. This concludes part 3 of chapter 9.